Mind If We Talk is produced in partnership with the Iowa Mental Health Counselors Association Foundation and Ramona Wink. This program is brought to you in part by Broadlawns Medical Center and 100 plus women who care. The content of this show does not necessarily reflect the views of the IMHCA Foundation. The IMHCA Foundation is not liable for the content of this show.
Welcome to Mind If We Talk, a program that covers mental health issues and services available in our community. Millions of Americans are affected by mental health conditions. Perhaps you or someone close to you is suffering in silence. Often we try to address these challenges alone, and we don't recognize when it's time to reach out for assistance. Throughout this program series, we'll introduce you to services available and how to take the first step towards healing. Broadlawns Medical Center sees mental health care as one of the community's biggest needs. The addition of their new outpatient mental health clinic in Des Moines offers a positive place for troubled patients to seek help. We talked with Kendra Perry, the clinical director of behavioral health at Broadlawns.
Here at Broadlawns, we offer individual therapy. We have about 10 therapists on staff, some of whom have various specializations or areas of interest that work to talk with someone one-on-one if they're having issues. We also offer group therapy, and groups are geared towards specific areas of interest or struggles that someone's having. So sleep issues, recent loss that they're experiencing. Groups are typically 8 to 10 people, and the groups are facilitated by a professional. And while it's helpful to have the professional in the room, certainly the most helpful aspect, the feedback that we hear, is being in the room with others like you, other people who are experiencing similar struggles. So here at Broadlawns, for our general groups that are geared towards specific challenges, a patient can call the 282-5695 number for more information to get registered for the group. And we also have the mental health group therapy program, which is more intense. So that's 3 times per week, up to 9 hours total a week. And lastly, we offer psychological testing. So if your medication provider or therapist suggests that you have psychological testing, what that means is you would come in for approximately a 2-hour time period and have tests that the psychologist would select to best answer the referral question. That might be wondering about the presence or absence of a diagnosis, of symptoms, ADHD, cognitive decline, and offering information in that way that can then go back to the clinician to guide treatment. As the clinical director of outpatient behavioral health at Broadlawns, while I miss clinical work somewhat, I'm still able to be involved just in a different way. And I think that's the piece right now that's really helped me transition into this role. An example from just a few weeks ago, one of our seasoned therapists heard from a client she's been working with for a very long time, and he was so appreciative of the services that he had received here and reflecting on his own recovery journey and her assistance with that. Here at Broadlawns, we are absolutely committed in wanting to be a leader in mental health. It's in our culture here, it's supported by leadership, and we strive to be accessible to everyone. The one final takeaway is that there is hope. You do not have to go at this alone. And sometimes because it is a mental health challenge or struggle, I think that presents a barrier to getting the help someone needs, or a delay in getting the help someone needs. And we don't want to treat that any different than we would for any other condition, going to the doctor for diabetes, for instance. And at Broadlawns, we are dedicated to getting you the help that you need.
For people suffering from conditions like severe depression, bipolar disorder, and schizophrenia, day-to-day life can be very difficult and often dark and lonely. The Broadlawns PATH program helps people struggling with mental illness to navigate their journey through everyday life. By making connections out in the community and providing support, the PATH program is giving hope and saving lives. We spoke with Julie Leffler, Senior Psychiatric Rehabilitation Practitioner, Jim Autry, Peer Support Specialist, and PATH participant Steve Lepeltak.
The Broadlands PATH program is unique because we work as a team with individuals who've been diagnosed with a mental illness, and that can consist of schizophrenia, bipolar disorder, major depression. We meet with people in the community where they live. We meet with people wherever they're at. They may be homeless, they may be in a shelter, they may be isolating in their apartment. They may be employed and just need extra assistance. It doesn't matter, but we'll help them.
I used to be in the PATH program, and so I have a kind of a unique perspective. I help with taking people to meetings and to doctor's appointments and to the gym, and I give guitar lessons to a few guys. But one thing that I can do that's unique is that when someone looks at me and says, "You don't know what it's like to be homeless or to deal with a mental illness for your whole life," I can say, "Yes, I do. I know what it's like to be homeless. I know what it's like to live in the Mission. And I know what it's like to deal with a mental health issue for my entire life." Well, I first got into PATH straight out of the hospital. They helped get me a place to live. They helped find ways to make money, to be employed. They helped me find a doctor, get on medication. Essentially, whenever I've fallen, whenever I've quit doing my part, and it's important that the person who's in PATH and who's in recovery, whether it be from a mental illness or a chemical addiction, is that they have to do their part. And whenever I quit doing my part and went off into the ditch, they were there to help pull me back out.
Before the PATH program, my day was pretty gloomy. Really bad mental illness. I wasn't taking my meds, whether it be, having nightmares at night, to using or to drinking. It was pretty dim. Well, my first step would be being hospitalized for probably the 4th or 5th time, and got in touch with people at Broadlands who got me in touch with PATH, and it's never-ending changing from there. I was pretty scared. I didn't know where my life was going at the time, and they figured out how to get me back piece by piece. PATH helps out in any way possible. Rides to doctor's appointments, to my job, to seeing my therapist. They do it all. I actually started a lawn care company this past year on my own with the help of PATH. Yeah, before the PATH program, I was losing friends every day. The little family that I do have left, wasn't talking to them. I was more avoiding them than anything. And then I hopped on board with the PATH program, and I just want to let people know to not be ashamed to ask for help.
Well, the one thing I want people to know about the Broadlands PATH program is for them to know that they're not alone and that we save lives. It's not just a ride to the doctor's office. We help prevent people from taking their lives and from doing other drastic measures, and that they're not alone.
I want people to know that there is hope and that they can get better on their journey, that where they're at right now doesn't mean that's where they're going to be in the future. There's no wrong door at Broadlands, and you're welcome to come in from service from anybody, and you'll get help and get better.
The decision to seek treatment is rarely easy. However, the most important step is to pick up the phone and call a professional. The New Connections program at Broadlands offers several unique options for group therapy and intensive outpatient treatment for people looking for help. We talked with psychiatrist Michelle Davids about the variety of services that New Connections offers. It's designed for people with both a mental health concern and an addiction.
At Broadlands, we have a program called New Connections, which helps people who have both a mental health concern and an addiction concern, and we call that a co-occurring program. And it offers several options for group therapy or intensive outpatient treatment. There are many options for the group therapy, including some interesting ones like trauma-informed yoga, music therapy, and art therapy. We also have a component that people can come to evening programs 2 nights a week if they, for instance, work during the day and they're unable to come to daytime programming. It's a really good option for people. Sometimes for people, it's really hard to know when they need help and when they don't. And a lot of people struggle with some sort of impairment in their life. For example, they're not showing up to work anymore. They're drinking more than they plan to, more often than they plan to. They were prescribed an opiate pain medication and they find themselves taking more than they should, or they're running out early. And if that's happening, I would encourage them, even if they're not sure if they should get help or not, that they could attend one of our orientation groups through New Connections and at least have a discussion. It can be really challenging to pick up the phone and tell someone on the other end that you think you're struggling with an addiction or that you think you're struggling with your mental health. And we know that addiction issues don't discriminate and they don't have any boundaries, and it can happen to any family at any time or any person at any time. And so what I would encourage them to do is pick up the phone and call. And what would happen is you would schedule an intake for an orientation group. And that would be through New Connections to talk about what the next steps may be. One of the reasons that I really love my job and I really love working with people who have struggles with addiction is that people get better. I've seen people get better. I've seen people gain employment when previously they've lost their jobs. I've seen people reestablish connections with family that they hadn't had in years. And that's really the value on my end and why I love doing what I do. Many people who have substance abuse issues also have mental health concerns such as anxiety, depression, post-traumatic stress disorder, also known as PTSD. Some people have various forms of psychosis. And so we have therapists on staff, we have psychiatrists on staff to help with those additional concerns in addition to the addiction concerns they may have. The New Connection staff and I would like for people to know that there are stumbling blocks along the way for people, and recovery is a journey, and we take pride in trying to meet people where they are.
Many new moms experience symptoms of postpartum depression, otherwise known as baby blues, after childbirth. But some new moms experience a more severe and long-lasting form of depression, known officially as postpartum depression. It isn't a character flaw or a weakness. Sometimes it's simply a part of giving birth. Let's learn more from people who have firsthand experience with this issue.
I'm a perinatal specialist here at Broadlawns. I provide individual therapy for women who are either new moms or have been moms before. It's really important for moms to feel supported, and here at Broadlawns we take that so seriously because we know how hard it is, either if it's your first child or your sixth child. We try to support moms because maternal mental health is often missed.
First part of my pregnancy was really hard. I battled a lot of nausea and trying to keep up at work with that. And being a perfectionist at work, it was really hard to give what I needed to give. I was struggling at home with just even getting out of bed on my days off. And because I felt tired, I felt like I wasn't doing what I needed to do, just even doing the dishes or cooking. And just overwhelmed with depression and anxiety that I wasn't being who I was before. So I decided to reach out to Broadlawns with individual therapy first, and that's when I met Christine Young. And after seeing her, she told me about this pregnancy and postpartum group.
We are so fortunate here at Broadlawns to have certified perinatal mood disorder specialties. Myself and Dr. Kendra Perry both specialize in perinatal mood disorders, and we bring that specialty to our free postpartum support group. And we also are 2 of 7 in the state to have that certification. And this is something we uniquely bring to Broadlawns to help serve moms and create a comprehensive maternal mental health care.
So the first time I decided to go to the pregnancy and postpartum group, I was a little nervous. Being a nurse, you sometimes think that you should be perfect. So that was hard for me walking into it. But I needed help. I knew I did. I knew I couldn't do this alone. So I decided to go. I met some amazing girls, even brought a friend with me. And we shared stories. We talked about how we were just so overwhelmed. We just would cry and cry at home because even though our friends had experience having babies, it was hard to relate to them because they weren't currently pregnant. And just having that support and really reaching out with people from the postpartum group really helped. I didn't feel as alone, and they would tell me that they were struggling to get out of bed, they were struggling with taking a shower, and just would cry for no reason. So going to the postpartum group really put things in perspective and allowed me to really touch on, yes, you're human, everybody's going to make a mistake, but we're all doing the very best we can.
Once a family or a mom decides that she really wants to get some help, it's important to go seek out her primary care doc or her OB or midwife. And if they're not available, to use our Broadlawns psychiatric urgent care if necessary. That's a easy service to offer and just get immediate advice.
I was actually very nervous about having postpartum, and it was a big concern. And I had talked about it in postpartum group, what the plan would be, and I talked to my family about this is what needs to be recognized. If you see this, just tell me and I'll go, because sometimes you don't recognize it. Sometimes it's the family members who really see it. So it's important to have that supportive network around you, and also going to the pregnancy and postpartum group too, because they'll share their tidbit. They're honest.
It's really common for moms to experience what's called baby blues, which is about 80% of moms in the first 2 weeks after labor, because I don't know about you, but we're really overwhelmed and we're exhausted. But after that 2-week period, we then become a little bit more than just baby blues, and we need to seek out some support at that time. If mom is having some racing thoughts, sometimes she can become overwhelmed and will start to be really obsessive, and we need to get some help with helping her feel more supported and loved.
At first, I was super excited when I gave birth, and it was a miracle. Then I went home. Things were very overwhelming. I wouldn't say I had an immediate connection to her, like some women do. I'd say it really happened over the course of 3 months.
Something I want people to know when they're watching is that they're not alone. Perinatal mood disorders is treatable and temporary. Our free support group here at Broadlawns can be a first-line triage to help moms find what they need and get them help very quickly. This is one of the most common complications of childbirth, but does not get the attention that other medical conditions like preeclampsia and high blood pressure are given during pregnancy. However, it's still the most common complication of childbirth. If there's any question or concern with the way you feel right now, there's no wrong door to access our services here at Broadlawns. We're here to help, and we want you to feel like you're not alone.
I feel like there's a huge stigma about people being pregnant. You should just feel happy after you have a baby. And I'm going to tell you, I did not feel happy all the time. Not even close. I felt overwhelmed, especially with having your first baby. And that's what the postpartum group really helped me with.
For more information for the pregnancy and the postpartum support group, please check our website and register if you need to. If not, please just come as you are, whenever you can. 5 minutes late is okay.
I recently did a ride-along with Officer Lorna Garcia, and we also met one of the Broadlawns Mobile Crisis Team members, Phil Sullivan, to learn more about this program.
So Mobile Crisis Team is for law enforcement or fire medics. They assist us in doing our job. So when we get that trip and we get there and we realize this is a mental health related trip, we can call on Mobile Crisis or have them en route already. They're going to get there, talk to that person, and get an assessment to find out what are they really needing at that point. and what kind of level of crisis are they at. Sometimes people need to go to the hospital, but sometimes they just need somebody to talk to, and they can provide that as well. Before we had the mobile crisis unit, officers only had basically two options: take them to jail or take them to the hospital. Unfortunately, with the hospital option, that used to be a several-hour process where we would just sit with the individual, not really knowing what we were doing. Now with the mobile crisis team, we don't have to do that.
You know, a lot of people don't feel comfortable calling the police because they feel that they're going to go to jail. The police have, over the last number of years, you know, when the police are going through the academy, they are trained in mental health. So they have a training, you know, an extensive amount of training. Some of those officers are taught by us because mobile crisis, a couple of my co-workers and I, we go to Iowa Law Enforcement Academy and we help train these officers on dealing with mental health patients and mental health situations. So, you know, when you're talking to somebody, what I want you to be aware of is that, you know, we want these people to get the care that they need and go to the correct place that they need to be at. And jail isn't the answer. You know, jail has mental health as well, but that's not where we want you to go. I mean, if you really need to go to the hospital, you need to go to the hospital. You know, the police will have, if they have charges on you, they can always file on you later, but they want you to get the help that you need as well. So if you're in a crisis, I don't ever want you to feel that you can't call the police officers for help, because that's what they're there for. That's what they're trained to do. So I would encourage anybody and everybody to call the police if they ever feel they or anybody that they know is in a crisis.
So a lot of times the families are just affected by those mental health crises as much as the individual that's experiencing them. So we can provide information on resources within the community, give them information on such as the mental health commitment process, to give them that support that they need so they know they're not alone in this, because I think a lot of times that's how they feel. I would say the most prevalent call that we would get is the depressed, suicidal individual. Almost daily we have at least a couple calls on a suicidal person. I think the public would be surprised by the frequency of that. And luckily they are calling, so it means there's that glimmer of hope for them to get them to the care they need. The one thing I'd like everyone to know is that we are here. Please use us. We are a resource for you and your family and friends that care about you to get you the help that you need. If you are feeling overwhelmed by daily life stresses, your anxiety is really high, and you just don't know what to do, call us. We might have a resource for you. Also, obviously, if you are suicidal, you're having those thoughts that you want to kill yourself, we want to help. Call us. There's a wide variety of things that you can call us for. It doesn't just have to be that you're suicidal. We're here for anything mental health related.
If you or someone you know is facing a mental health crisis, please call 911. To utilize one of the many resources discussed in this program, check out the Broadlawns Medical website. The Iowa Mental Health Counselors Association Foundation, Broadlawns Medical Center, and 100+ Women Who Care are the proud sponsors for this program of Mind If We Talk. Thank you for watching. I'm Ramona Wenk.